All right, welcome everybody to the Administrative Services Committee meeting, November 6, 2023. Our first item is approval of minutes from the 10/16 meeting.
Make a motion to approve the minutes.
I'll second it.
Got a motion and a second. All in favor say aye.
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 Opposed? Carried. Brings us to the privilege of the floor. Is there anyone here in person to speak to the privilege of the floor? We know him.
Good evening, Mr. Chairman and other members of the committee. I'm Tom Nelson. I represent Legislative District 13 in Jamestown. We all know that Chautauqua County has an ongoing, well-documented drug crisis with extreme rates of opioid use, substance use disorder, overdoses, and overdose deaths. We know that Strong Start Chautauqua is an initiative begun in the summer of 2019 to address the growing crisis in prenatal substance exposure in Chautauqua County. We know that Strong Starts is a program that uses evidence-based strategies to assist some of the most vulnerable infants and young children in the county. These are children affected by prenatal trauma, including exposure to alcohol, tobacco, marijuana, and illicit drugs that can harm their health, development, intellectual functioning, decision-making, and behavioral capacities throughout their entire lifespan. We know that Strong Starts is a resource available to county residents that explicitly works to prevent, identify, and treat prenatal substance abuse exposure, or PSE. We know that PSE is at a catastrophic level in Chautauqua County, 5 times the state rate. We know that the program is available and working for a lot of people. More than 5,000 children and 587 pregnant women have directly received at least one service from Strong Starts. The Strong Starts Resource Manager, funded in part by the ARPA grant, had 1,163 interactions with community members needing resources, referrals, and services. 2,790 parents and caregivers were actively engaged in prevention, education, through the self-initiated use of Strong Start's social media and texting platforms. So we know that the program has been effective and used by many. However, we also know that 2 weeks ago, County Executive Wendell canceled an ARPA-funded contract with the Healthy Communities Alliance, which will impact the Strong Starts initiative. We don't know why. Stopping the funding for the program that has been this successful raises many questions. What was the rationale for the termination of Strong Starts ARPA contract? What, if anything, will take its place? Why was there no notification to Strong Starts prior to, at the time of, or after the termination of the contract? There were questions about the process. This was a contract that was approved by the ARPA committee and then unanimously approved by the county legislature. So why wasn't the committee or the members of the legislature involved in the termination of the contract? We were told the money was paused. What does that mean? Where is the money now? Will the money be returned to the ARPA funds? And if so, what will they be used for? I think the people of Chautauqua County, the women and the children that are affected by this program, deserve answers to these questions. I think that we can still have a good outcome here. I'm hopeful that we can get beyond the impasse and consider reversing the termination of the funding. I think if we involve Strong Starts, the county executive, the ARPA advisory group, and other leaders, we can do this. This is a good program. It makes a difference. Isn't that why we're here? Thank you.
Thank you. Is there anyone else? Seeing no one else?
Well, we're speaking to first privilege of the floor. Or no?
Seeing no one else, we have 2 letters to read.
Okay.
And being the chairman, I get to start, so I'm going to read the first one. Sorry,
That's okay.
I was heading in that direction.
Gotcha.
This first letter is from Ann Battaglia, Chief Executive Officer, Healthy Community Alliance. This is to the Chautauqua County Legislature and the Administrative Services Committee meeting. Dear Administrative Services Committee, Chairman Scudder, and members of the committee, I, Ann Battaglia, Chief Executive Officer of the community-based organization Healthy Community Alliance, provide the following statement to the Chautauqua County Legislature, Administrative Services Committee, and follow-up to the termination of the ARPA contract supporting Strong Starts Chautauqua. Healthy Community Alliance is a New York State rural health network, one of 31 rural health networks across the state, funded by the New York State Department of Health, Charles D. Cook Office of Rural Health. As a 501c3 nonprofit, Healthy Community Alliance's mission is to improve the quality of life of rural communities in Western New York through broad-based, inclusive partnerships that focus on wellness, disease prevention, and health promotion. In Chautauqua County, our organization offers many services to residents. We are the New York State of Health Navigator Agency, with health insurance navigators assisting county residents with enrollment into affordable health coverage. Additionally, we hold the New York State Department of Health Perinatal Infant Community Health Collaborative grant, providing non-clinical home visiting services that promote healthy behaviors and healthy outcomes for pregnant and postpartum women and their young children. We work with the county's Office for Aging and connect family caregivers of older adults to much-needed respite. And we participate in many collaboratives that work to leverage additional funding and resources to meet the needs of county residents. Another core competency of Healthy Community Alliance is prudent grant management. We have been and continue to be the fiscal sponsor for many grants that support rural health initiatives. We are selected because of our reputation as a trusted community-based organization and for our responsible fiscal stewardship. Over the past 3 years, we have served as fiscal sponsor for many grants and contracts that support the Strong Starts Chautauqua Coalition and its system building initiative. Up until November 5th, Healthy Community Alliance served as fiscal sponsor at the request of the Chautauqua County Department of Health and Human Services for the public health ARPA project that supported Strong Starts Chautauqua activities, including awareness and prevention education and capacity building for universal screening and referral. While that 3-year contract was unexpectedly and prematurely terminated by the county, it has been Healthy Community Alliance's privilege to provide prudent fiscal management and spend the funds totally in accordance with the ARPA contract amendment and budget modifications signed by the county executive on May 8th, 2023. The budget modification was collaboratively developed and CCDHHS to effectively allocate the funds to meet the public health ARPA project's intentions, as well as the Strong Starts Coalition's documented and stated priorities. We regret that the county has since terminated the contract and paused these critical activities which support community and partner engagement toward the prevention and early identification of prenatal substance exposure. Healthy Community Alliance remains committed to good stewardship of the resources entrusted to us to address the health and well-being of our rural communities, and we look forward to ongoing partnerships to meet the needs of Chautauqua County residents. Respectfully submitted, Ann Battaglia, Chief Executive Officer, Healthy Community Alliance. And Susan.
Okay, this letter is from November 6th to the Chautauqua County Legislature Administrative Services Committee regarding privilege of the floor statement from Strong Starts Chautauqua Prenatal Early Childhood Advisory Council. Dear Administrative Services Committee Chairman Scudder and members of the committee, the co-chairs of the Strong Starts Chautauqua Prenatal Early Childhood Advisory Council are providing the following statement to the Chautauqua County Legislature's Administrative Services Committee to address the discussion topic for the November 6th committee meeting. the PCAC, which is the Prenatal Early Childhood Advisory Council of the SSC, which is the Strong Starts Coalition, was formed in 2022 to help address workforce challenges and transition from consultant-based guidance to a locally sustainable leadership of clinical infrastructure and operations. Strong, healthy children are the foundation for our county's future. Yet there is a reason to believe we can all work together to do better for our youngest community members, particularly the considerable number being born exposed to potentially harmful substances and toxic stressors that can impact them across the span of their lives, resulting in health and behavior problems, neurocognitive issues, sensory and adaptive complications, poor educational outcomes, and higher risk of child abuse and neglect. At 5 times the New York State rate, prenatal substance exposure to alcohol, tobacco, marijuana, and illegal drugs among the county's newborns and young children must be addressed through innovative prevention, education, risk identification, and specialized treatment strategies. This situation is described in the Chautauqua County Community Health Assessment, which notes that the rate of newborns affected by maternal use of drugs of addiction continues to be a grave concern in Chautauqua County. The impact of prenatal substance exposure puts a significant strain on families, education systems, and system-wide finances for generations. Without proper screening, early intervention, and treatment, children experiencing adverse effects of prenatal substance exposure and related life trauma are not likely to succeed in preschool, let alone successfully complete high school or college. In response to this crisis in Chautauqua County, the SSC Coalition was formed in 2019 by local stakeholders and community leaders who sought to use an evidence-based, proven system approach to fill gaps in prevention, education, risk identification, and specialized treatment approaches that meet the unique needs of communities plagued by prenatal substance exposure. As a result, the evidence-based 4-tiered screening, assessment, referral, and treatment SART model, developed by internationally renowned expert Ira Chasnoff, MD, was selected as the optimal choice to guide and train partners in building and implementing a local SSC SART system, the only SART system in New York State. Since 2020, more than 5,000 children and over 580 pregnant women have directly received at least one service from the SSC initiative. The SSC Community Initiative uses multi-system strategies that leverage and enhance the ability of existing programs, organizations, and systems of care to effectively prevent and mitigate prenatal substance exposure and its adverse effects on children, families, and the community. This collaborative seeks to complement and strengthen, not duplicate or compete with, local providers and partners, including in the SSC Coalition and its PCAC, our county departments of health, social services, and mental hygiene, various health and mental health care providers, UPMC, Chautauqua Hospital, Jamestown Community College, Jamestown Public Schools, and other districts, child care and preschool providers, community-based and social organizations, and philanthropic foundations. Over the past 4 years, despite challenges and interruptions caused by COVID-19, SSC partners forged ahead to pilot its SART system. Throughout this time, through 10/2/23, 8,723 child development screenings were performed. Results indicate 16%, or 1,352 screenings, show indications of concern, which is higher than population norms for their peers elsewhere. 1,343 child regulatory behavior screens were performed. 53%, or 712 screenings, show reason for concern, which is significantly higher than norms for other communities in which the screener, if used. 63% of 587 pregnant women screened in the county across socioeconomic levels and ages have used a substance potentially harmful to their children just prior to or during pregnancy. The SSC resource manager, funded in part by the county ARPA contract, has 1,163 interactions with community members needing resources, referrals, and services since her hire in April 2021. The SSC transdisciplinary team, which meets to review child evaluations, helps families develop treatment plans, engages children and families in community-based treatments, was established in late 2021. The team began seeing seeing cases regularly in late 2022 once protocols, processes, and secure data sharing had been established. As of 10/2/23, the team had 54 current or pending cases, 33 families were on a waiting list, while 21 had been engaged in assessment, treatment planning, or treatment and therapy. More than 700 professionals and community members have attended training, networking, and continuing education events sponsored by the SSC Coalition since its inception. Thus far in 2023, more than 500 hours of training, technical assistance, and expert advisement have been provided for SSC partners and key stakeholders. The express purpose of these efforts is to increase local capacity and expertise to implement and sustain the evidence-based SART model instituted by SSC without extensive reliance on external consultants. A fully implemented developmental screening and secure multi-sector service coordination and communications hub has been created using software customized for local needs and co-designed by SSC partners. This allows partnering organizations from different fields to work more seamlessly together on referrals and follow-up with one another to help families get connected with the right services at the right times. SSC has launched Bright by Text, a national texting program customized with local content for parents and caregivers that is proven to build nurturing caregiver-child relationships and positively impact a child's healthy development and school readiness. To ensure that prevention-focused education information provided to community members is research-backed, cost-effective, and tested for use with our target population. SSC engaged with a nationally recognized social media company which specializes in providing content for prenatal early childhood systems and communities with high levels of alcohol and substance misuse and prenatal exposure. I got a half more page, sorry. As a result of the social media and Bright by Text campaigns, more than 2,790 parents and caregivers have elected to receive information and messages on pregnancy, parenting, early childhood topics, and local resources, and have tapped into content more than 44,000 times. In the spring of 2023, PCAC endorsed JCC to coordinate the SSC SART clinical administration and leadership under the college's emerging Center of Excellence in Wellness, aligned with college and community priorities and with the support of JCC administration and the PCAC. JCC has embarked on providing neutral leadership for SSC clinical functions, fostering collaboration, effectively coordinating and convening partners, providing administrative support and structure, and developing critically needed related workforce and academic offerings. Recognizing the need to build, maintain, and sustain the proven piloted SSC SART system, the PCAC fully supported JCC's successful application to the Ralph C. Sheldon Foundation in September 2023 for a business and implementation plan for the local SSC SART system. The plan will identify how local expertise can be leveraged, enhanced, and expanded to operate a local neurodevelopment center and to specify the conditions, protocols, and resources needed to support its sustainability. The business plan is projected to be vetted, completed, and disseminated by August 31st, 2024. Because of the apparent need for greater understanding of the intent and collaborative work of the SSC system, SART system, the SSC Coalition and its PCAP members welcome the opportunity to engage the community in a public information session. The session will be held on Monday, November 13th at 5 p.m. in the theater of the Carnahan Building of the Jamestown campus at JCC. Sincerely, co-chairs of the Chautauqua County Prenatal Early Childhood Advisory Council of the Strong Starts Coalition, Andrea Walsh, MD, Christine Schuyler, RN, BSN, MHA, Michelle Godfrey, CODA, /L. So she must be. Okay, thank you. That's the whole thing.
Okay, thank you, Susan. That will close the privilege of the floor. We'll move on to our first item, local law intro 1123, a local law amending local law 1322, providing for a management salary plan for county officers and employees, training and development coordinator in the Department of Human Resources.
Hi.
Please state your name.
Debbie Mikowski, Director of Human Resources.
Thank you.
So the proposed local law is a request to create a new title within the Human Resources Department. This is not to request an additional position. It's not a request to add to headcount. It's simply an effort to create the title so that we can move forward with an existing employee whose current title doesn't necessarily match her roles and responsibilities. So we would move this individual from a personnel technician to the training and development coordinator. No impact to the 2023 or 2024 budget. Simply the moving this individual into the new title, the old title of personnel technician would then no longer exist. Questions?
You explained that really well, and you also sent an email, so
Correct.
yeah,
Thank you.
it sounds like a great way to acknowledge someone's job description without having an impact on numbers. Thank you.
Anybody else?
I have nothing.
All good? Thanks, Don.
Thank you.
Thank you.
All right, item number 2, proposed resolution, amend the 2023 budget, Office of the County Executive. Anybody here to speak on that?
Hello. So, and PJ can give input too if you want, obviously. We
Just
determined,
State your name.
Oh, yep.
just For the folks at home.
I'm Justin Gould. I'm Chautauqua County's Media Information Officer.
PJ Wendell, Chautauqua County Executive.
Thank you.
So we determined that at the end of the year, we have remaining funding that was unused from my Media Information Officer budget since I started in June 1st of this year. And we are requesting to have that transferred to our equipment and then software budget so that we can purchase additional equipment that I plan to use to help publicize the county.
Just a clear reminder that this body unanimously approved this position in 2023. The money was appropriated effective January 1st, and as Justin said, he did not take this position until June. So we have about a half a year salary that has not been used. So then the total of this implementation is $7,077.66, which is still a significant savings to the county as we move forward in a vacancy savings at the end of the year.
So we're not using all the money that
Not
we
even
saved.
close. No, no.
We just have targeted equipment that we want to buy, and
Yep.
this is the cost.
Correct,
Okay.
yep.
Okay. Any questions, comments? I have none. Seeing none? All in favor, say aye.
Aye.
Opposed? Carried.
Thank you.
Thank you.
Thank you.
Is your pen with you? Can you borrow mine for now?
No, I get nothing. Scratch their eyes. Just ran these from twice. Is there your phone? Looks like it's- Okay. That brings us to our next item, a discussion, Strong Starts Program, Healthy Communities Alliance. Before we get into this discussion, I'm gonna ask Patrick if you come down forward and kind of help us moving forward here.
Sure, thank you. Patrick Sligo, County Attorney. No, on the agenda is the discussion piece on the ARPA discussion. It involves some contractual matters, also some personnel issues. I would suggest that this body consider making a motion to enter into executive session at this time based on the fact that there is already proposed pending litigation on this matter, as well as the fact that this could also discuss individuals' employment history, particularly matters of persons, corporations, potential discipline, suspension, or removal of particular persons. And this would be found under Public Officers Law, Section 105, F, and I think I mentioned D, yes, proposed litigation. So I would make that suggestion to this body to entertain that motion.
Okay. Somebody make that
I'll
motion?
make a motion to go into executive
We
session.
have a
I'll
motion.
second it.
Second it. All in favor of going into executive session, say aye.
Aye.
Opposed? We are now entering into executive session, which means we will turn off the television and
Everybody leaves.
everybody,
Bye.
yeah. If you wanna
To the
move
top
on
mics
forward.
here. Oh, that's